Hi everyone, I'm Tine Buffel. I'm the director of the Manchester Urban Aging Research Group at the University of Manchester. And in this video, I aim to summarize some of the key points from a paper I wrote with colleagues from the Manchester Urban Aging Research Group entitled Lockdown by Inequality, Older People and the COVID-19 Pandemic, a paper which was published earlier this year in Urban Studies. And the key argument is that post-COVID-19 recovery strategies need to focus on building back fairer cities and communities, and that this requires a strong embedding of age-friendly principles to support marginalized groups of older people, especially those living in deprived urban neighborhoods trapped in poor quality housing. And the paper makes a couple of points. The first is about how the virus has shown the extent to which ageism and stigmatization of older adults is entrenched in our policies, institutions, communities, and the media, but also ultimately in our society's response to the pandemic. The second point is about how COVID-19 has exposed and exacerbated the inequalities in aging. And one important issue raised by research, for example, concerns the intensification of discrimination and isolation experienced by marginalized and stigmatized identities in the context of COVID-19. Research in the UK, for example, found that older lesbian, gay, bisexual, transgender, and queer older adults were at greater risk of isolation and discrimination during the pandemic. Research, again in the UK, but also in France and other countries, reported that people from ethnic minority groups of all ages are much more likely to die from COVID compared with other groups. And research in the US has shown how racism and ageism together shape higher risks of COVID-19 exposure and disease, as well as poorer health outcomes, especially for Black older adults. But the coronavirus crisis has coincided with another crisis, and that is a crisis of a long period of deepening inequalities affecting many of the neighborhoods in which older people live, as a result of public funding cuts and austerity, which has resulted in a widening of health inequalities. So the pandemic has had a disproportionate impact on such deprived neighborhoods that were already severely affected by cuts to public services, loss of social infrastructure, and pressures on the voluntary sector. A shocking finding from research in the UK is that people living in the most deprived neighborhoods were dying at twice the rate in the first wave of the pandemic compared to those living in more affluent areas. And similarly, a study of 10 major cities in the US found a disproportionate burden of both infections and deaths in areas with a larger percentage of the population living in neighborhoods with higher rates of poverty. So in our paper, we developed the argument that older people living in deprived urban neighborhoods are likely to experience a double lockdown, suffering the effects of enforced social isolation as a result of COVID-19 instructions to self-isolate, whilst at the same time living in places affected by the loss of services and social infrastructure, which already made them more likely to be excluded and isolated before the pandemic. In response to this, we have developed a 6-point age-friendly recovery plan for the future of the city. And the first action concerns the needs for a focus on supporting the most vulnerable groups of older people, and the importance of prioritizing resources and community-centered interventions, especially in deprived areas, where people are often cut off from social infrastructure and services that are so important for their quality of life. Secondly, the pandemic has also shown that much more work needs to be done to transform the social attitudes towards aging and combat the stereotypes, the prejudices, and the discriminatory practices towards people based on their age. We really need to continue to challenge the dominant narratives around aging that are often centered around stereotypes of vulnerability and passivity, and make much more visible the vital contributions that older people have in society, as caregivers in their communities, as volunteers, as workers, and so on. Third, there is a risk of age segregation occurring as a result of COVID-19, and therefore it will be essential to foster opportunities for intergenerational contact and strengthen bonds between different generations. Fourth, community and voluntary organizations have filled an important gap in service provision by providing social, psychological, practical support during the pandemic. Whether this was through telephone call programs or supporting digital inclusion, delivering food parcels, or providing information, it will be crucial in the future to support such organizations who often were already in financially precarious positions before the pandemic hit. Fifth, we need more strategic partnerships among public health professionals, local authorities, universities, housing providers, architects, community organizations, and older people in developing future age-friendly interventions. And finally, older people should be at the center of designing such interventions. Whether this involves projects aimed at improving digital inclusion or opportunities for better inclusion of older people in social and green spaces in cities, strengthening intergenerational bonds, or developing emergency responses and preparedness plans, it is vitally important to account for the diversity within the older population, recognize older people's capacities, and harness their experience in rethinking the future of cities. Thank you very much. And if you want to learn more about this article, it is publicly open access available through the journal Urban Studies. Thank you so much.